Hi everyone, welcome. Thank you so much for being here. Welcome to On the Ground in Gaza. I report back from healthcare workers. My name is Ami Fishman and I'm really honored to be here with you all today for this important conversation. A little bit about me, I've worked here at DPH for over 8 years and I'm really proud to be one of the founding members of our Health Justice for Palestine affinity group. We are one of the sponsors of this event, along with the California Nurse Midwives Association, the Faculty and Staff for Justice in Palestine group at UCSF, Healthcare Workers for Palestine Bay Area, and the DPH Rasa and Indigenous Affinity Group. Also want to give a shout out to Luna's, who is our wonderful neighbor who supplied the food for us today. Like so many of you, I joined DPH because I believe in the mission and the values of the department. A mission to support the health and well-being of all of our residents and communities rooted in racial and social justice, equity, and a passionate commitment to health and human rights. Over the years, I've seen DPH take a stand in support of social, economic, and political issues of justice facing our many communities. Standing up for undocumented and immigrant community rights to care without fear of deportation or discrimination, proudly proclaiming that Black Lives Matter, rising for LGBTQ+ rights, supporting decriminalization of homelessness, and so much more. This has often included actions of governments, including our own, that devalue and destroy life and well-being. Over the last 11 months, we've witnessed with horror the destruction of health infrastructure, hospitals, and countless lives throughout Palestine, and especially in Gaza. As healthcare workers, and really just as human beings, it has been devastating to see the broad-scale violence towards and dehumanization of Palestinians, including US-made 2,000-pound bombs that kill entire families, destroy schools full of children, injure and kill doctors, humanitarian and aid workers, people seeking shelter in tents, so many lives and communities devastated, so many disabling injuries, so much manufactured disease. This has been directly funded and armed by the US government, our own tax dollars and weapons. We have also seen and been part of a rising movement of healthcare workers speaking out in support of the lives and safety of everyone, including those in Gaza. Many of our organizations have remained silent, as we have seen our colleagues attacked, called anti-Semitic, terrorists, or hateful for standing up for human rights, or even lost their jobs as a result of their commitment to the value of all lives. The amount of interest in this event, all of you here today, we had over 190 people register for this event, is a testament to the fact that so many of us are grappling with this contradiction, the injustices and the silences that we bear witness to. As healthcare workers committed to equity and justice, we know that engaging in critical thinking and dialogue and challenging oppression wherever we see it is essential to our mission. As a Jewish person, it is particularly distressing to me to see unfounded accusations of anti-Semitism weaponized to silence those standing up for the dignity and humanity of all people, including Palestinians. Being able to truthfully and critically engage in conversations that align our actions and our values is essential, including calling out any and all attempts to dehumanize or devalue. And that is the spirit of our conversation today. We are here to learn and to listen, to engage in good faith, and in alignment with our shared commitment to the health and well-being of all those whose lives are strategically devalued. Next slide. It's customary in events like this to say the land acknowledgement. And so we offer this. We acknowledge that we're on the unceded ancestral homeland of the Repression, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Repression have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Repression community and by affirming their sovereign rights as First Peoples. Here in the Bay Area, we're privileged to have access to leadership from indigenous communities that invite us to not only say this acknowledgement, but to take action and active support, including donating to the Association of the Repression to support rematriation of the land. You can learn more about these efforts by going to rematrish.org, or in the East Bay by going to seguritelandtrust.org. The land acknowledgement asks us to reflect on the fact that we are on the unceded and ancestral land of the Ohlone people, whose homeland was taken from them by force, the same kind of force that we see in Gaza and in the West Bank today. Forced displacement many times over, ethnic cleansing, genocide, and theft and colonization of the land. The parallels are many and frightening, and it's important to recognize that these same patterns continue to exist and play out across the world, as does resistance to and resilience within them. In just a moment, I'll introduce our speakers and turn it over to them, but before I do, I wanted to let you know, go to the next slide please, that we'll be gathering questions throughout the session using this QR code that you see on the screen behind me, and that will also be in the chat links for those on Zoom. And we'll have some time later in the program for Q&A. Please share any questions that you have. We may not get to all of them, but they'll help inform our future events. Our wonderful guests today are Bridget Borchios, is a certified nurse midwife and reproductive health nurse practitioner dedicated to reproductive justice and health equity. Born and raised in the East Bay, she combines her clinical expertise with a passion for social activism, working to improve healthcare access both locally and internationally. In May 2024, driven by her commitment to global health and social justice, Bridget volunteered at Emirati Maternity Hospital in Rafah, Gaza. During her month-long mission with the Canadian organization GLIA, she provided critical obstetric care alongside local healthcare providers amidst the ongoing genocide. This experience allowed her to witness firsthand the challenges faced by Palestinians and advocate for their healthcare needs. We're also joined by Dr. Jess Ghannam. Jess Ghannam is a clinical professor of psychiatry and global health sciences at the School of Medicine at UCSF. His research areas include evaluating the long-term health consequences of war on displaced communities and the psychological and psychiatric effects of armed conflict on children. Dr. Ghannam has developed community health clinics in the Middle East that focus on developing community-based treatment programs for families in crisis. He's also a consultant with the Center for Constitutional Rights, Reprieve, and other international NGOs that work with torture survivors. Locally, he works to promote and enhance the health and wellness of refugee, displaced, and immigrant populations from the Middle East, North Africa, and South Asia, and has established a community-based mental health treatment programs to support these communities. At UCSF, Dr. Ghannam develops culturally competency training programs for staff, students, and faculty, working with patients from the Middle East. He is Palestinian and has worked in Gaza for over 25 years, building community mental health clinics. So please join me in giving them both a warm welcome. And
thank you so much. That was really a beautiful introduction.
It was, thank you.
It's really a delight to be able to share this space with you all today. Thank you for coming out. Really special gratitude and thanks to the organizers who put this together. It's an extraordinary group of human beings that pulled this together. So much gratitude to Ami and everybody who did this, and for all of the sponsors. I'm going to do just a few introductory comments, and then Bridget and I are just going to have a conversation. And Bridget, it's always a delight to be on the stage with you, you know that. So I'm looking forward to our conversation. I don't know what's going to happen. I don't know what we're going to talk about. But I think it's important that we kind of ground and contextualize where we are today. I still have a hard time wrapping my mind around the reality. And when I wake up every morning and I realize we're approaching 1 year of a genocide against Palestinians in Gaza, it's shocking when you take pause to comprehend the magnitude, the severity, and the intensity of that reality. We are bearing witness to the most brutal assault on human beings and a civilian population in the modern era. Nothing comes close to the brutality, the depravity, the gruesomeness of the attacks on civilian Palestinians in Gaza on the civilian infrastructure in Gaza, the complete destruction of the healthcare infrastructure, and in terms of the depravity aspect of it, the fact that as we're speaking now, as we're sitting and gathered here in San Francisco, that every single child in Gaza is facing famine. That this is a state-sponsored, human-induced genocide and catastrophe. Children are starving to death deliberately. There are thousands of trucks waiting to get into Gaza to deliver food, water, and medicine. There are no complete functioning hospitals or clinics, and Bridget and I will get into that. Just today, the health ministry in Gaza announced that about 1,000 health workers have been killed in Gaza, which is an extraordinarily high number. And in addition to that, hundreds of health workers, hundreds, have been arrested, detained, and tortured by the Israeli government and military. So the level of destruction exceeds any kind of comprehension that we have in terms of understanding a war. This is not a war. This is a complete devastation and genocide and a continuation of the ethnic cleansing that has been going on in Gaza for 76 years. So what I'd like to do is just kind of contextualize a few things about that because it's really important. I mean, people will come up to me and say, wow, the situation in Gaza is terrible right now. And I have to say to them, but wait, before October 7th, things were horrific in Gaza. Okay? And that's hard to comprehend. Having myself worked in Gaza for 25 years, having been there during 2 of the wars, since 2005, there have been 5 devastating, including the current devastation and genocide, there have been 5 wars in Gaza. It's been 16 years of a total blockade of food, water, and medicine on this collective population of 2.5 million Palestinians living in Gaza. Prior to October 7th, 80% of Palestinian children were food insecure. Can you imagine that? That's before October 7th. And now they're facing famine. Another kind of devastating kind of statistic is that prior to October 7th, some of the research I've done there for many years, 80% of Palestinian children prior to October 7th had at least 1 or 2 symptoms of post-traumatic stress disorder. Now, when we compare that to Iraqi children or Afghan children or children anywhere else in the world, in terms of looking at trauma exposure, and again before October 7th, Palestinian children are experiencing traumatic events that double and triple any other community that's been subjected to traumatic events. It's just extraordinary. Now, what makes the situation in Palestine even more disturbing, and this is where the historical contextualization comes in. This genocide in Gaza right now didn't just happen overnight after October 7th. It is the product of 76 years of an attempt to essentially ethnically cleanse and remove indigenous Palestinians from their connection to their land, okay? You know what's really interesting? I hear this from people all the time. People will say, wow, Dr. Ghannam, this topic is so complicated. It's been going on for thousands of years. And then I just have to shake my head in disbelief. That's a complete false statement. It's a complete fabrication. This, what we're witnessing in Palestine today, in Gaza, and in the West Bank, and in Jerusalem, is an uninterrupted line from 1948 to where we are today. Because in 1948, essentially from 1947 to 1949, and this is what's really important, before Israel even existed, before even the state of Israel existed, there was Palestine, and Palestinians were being ethnically cleansed and physically removed from their villages and homes by Jewish militia groups, even before Israel existed. This is something many people don't understand in terms of the historical context. So that between 1947 and 1949, 800,000 Palestinians were forcibly removed from their homes and villages by these Jewish militia groups. We can't call them Israeli because, again, this was before the state of Israel even existed. 500 villages were depopulated. So from 1948 to where we are in 2024 is this uninterrupted line of steady, slow, and now acute ethnic cleansing, settler colonialism, apartheid, and now really the aim of this project, this settler colonial project. And we know there are many settler colonial projects. We happen to live in one right now. But the ultimate aim is to eradicate, dehumanize, delegitimize, and erase indigenous communities. And what we're seeing today in Gaza is that uninterrupted line from 76 years ago to where we are today. And so I think it's important to historically contextualize it, because this is not new. This is part and parcel of the project that has been going on in Palestine. What makes what's happening in Gaza right now, what makes it much more disturbing, is that the pace, the intensity, the brutality, and the depravity, and the complicity with the United States government and military. So what's really important to understand about what's happening right now, this would not be occurring without the full backing and blessing of the US government. Now, when you hear people talk about, like Antony Blinken or Joe Biden or whomever, we're so close to a ceasefire, it's rubbish. It's unequivocal rubbish. There's no ceasefire. There won't be a ceasefire. The only way in which things will stop the genocide and the deprivations and the depravity in Gaza, if we as a community can come together and put a stop to it. But we have to understand that what's happening in Palestine right now and in other places is part of the US foreign policy, is not just complicit, but completely supporting this genocide right now. Okay, should I start my introduction?
Sure, go ahead.
Oh, that was a prelude to my introduction. When a Palestinian says to you, "Let me be brief," you should be very skeptical. Let me be brief. Now, I've been working in Gaza 25 years, and prior to October 7th, getting into Gaza, working in Gaza, and being in Gaza was always death-defying and challenging. The multiple checkpoints, the strip searches, the dehumanization, that even though I'm an American citizen, I'm not treated as an American citizen when I go to Gaza. I'm treated as a Palestinian, which I'm proud of. I've had Israeli soldiers, who are also American citizens, by the way, look at my passport, spit on it, and throw it to the ground and stomp on it. The process of being able to get in before October 7th was extraordinarily painful and difficult, okay? So after October 7th, when the 2,000-pound American bombs were dropping on civilian populations, we were all scrambling, right? We were trying to fathom and understand, the depth of this, but we were also thinking, how are we going to help and do something about it? A number of months went by. We started to develop this kind of possibility of sending medical missions to Gaza. It is a harrowing process to get into Gaza under normal circumstances, and under these circumstances, extraordinary. People would call me, and I would do my informed consent and basically try to talk them out of it. So I get this weird message from Bridget. She wants to go to Gaza. And I try to talk her out of it, of course, which I found is kind of useless, to try to talk Bridget out of anything she wants to do. And she made the courageous and heroic decision to actually go. Amazing. And deliver babies. If you can imagine that, right? In the context of this mass extermination and destruction of an indigenous community, to be on the side of this contradiction in delivering babies, truly amazing. So Bridget, my first question for you is really kind of just like, again, contextualizations. Like, for many health workers, like what is happening in October 7th and subsequently was really their first introduction to Palestine and Palestine work. But that wasn't the case for you. So my question for you is, how did you come to Palestine?
Thank you, Jess. I came to Palestine through work around anti-racist work and race equity work. And I think that the really important thing that Palestine has highlighted for all of us is how interconnected all of these struggles are. How interconnected indigenous struggles in land back is with Black Lives Matter, is with a free Palestine, is with an LGBTQ and trans movement, right? Like, it's very important. And I think that the one thing that Palestinian activism has done since October is really kind of start to create larger, solidarity movements instead of as siloed things. So that's how I came to Palestine, is that a friend who I was doing Innocence Project related kind of protesting with for Troy Davis, who was executed in like 2010, right. 2012. Much like a gentleman, Mr. Williams, actually, in the state of Missouri, who's going to be executed and is innocent on September 24th. So please look the Innocent Project up today and call and get support for that innocent man. They brought me to protest, and that was kind of my introduction to it. But I definitely did not step into work as significantly until October 7th. And the thing that really captured me was how deliberate and systematic the killings of healthcare workers were in hospitals. Like, it just seemed so wildly unprecedented. And as a midwife who came to this work through a lens of social justice and reproductive justice, it felt very clear to me the importance of my voice in this, and eventually, my journey to Gaza, to support in this and to stand in solidarity with Palestinian healthcare workers.
Yeah, there's so much to unpack about that, and we may have to circle back to it, but you really bring up a critical point about that intersectionality. That gets lost a lot for people who are maybe new to Palestine work or Palestine solidarity. But maybe we can come back to that, because that's really critical, right?
One important note, though, too, is that during the beginning of Black Lives Matter movements, Palestinians were informing those organizers about how to handle interactions with the cops and pepper spray and that sort of thing. The police measures that have killed multiple Black and brown people are measures that are tactics that have been taught to them by the Israeli army, who trains American cops.
Exactly. That's the intersectionality part. Yeah. So we're talking about it, obviously, a number of months after the assault on the civilian infrastructure in Gaza starts on October 7th. We're bearing witness as a healthcare community to the utter destruction of the healthcare infrastructure. Nurses, physicians, healthcare workers are being murdered basically every day. Hospitals are being destroyed. Yet you have it in your mind that you still want to go. That's pretty extraordinary. Can you tell us a little bit about just like what it was like for you? I mean, because the journey you went through from San Francisco to Gaza was actually pretty complex. So can you tell us give us a picture of that?
I will say that the Gaza that I went into was very different than the Gaza that I left. And I don't know if I would have been as brave now as I was then. So I left in late April to travel to Egypt And then eventually on May 1st, I entered Gaza through kind of the Sinai Desert, through the Rafah border crossing. And despite kind of...
But wait a minute, you missed the 8-hour bus ride from Cairo
Okay. Yes,
to
through the Sinai Desert.
Through the Sinai Desert.
Where there were
tons of checkpoints.
And many things. Small potatoes compared to...
Thousands of trucks.
Thousands of trucks just piled up
with
in
food.
extreme heat that all say UN, WHO, like World Food Bank, all of that, just sitting there waiting. We went through kind of the Egyptian checkpoint, which was between Rafah, at the Rafah border crossing, which was wildly kind of disorganized and chaotic. And we came out on the other side to Gaza through Rafah. And within a week, that border had been taken from Gaza, from any humanitarian aid worker who wanted to come in, and thus completely shifted the already devastating conditions in Gaza and any opportunity for people really to come in and out. My journey there, my time there was supposed to be a 2-week mission, and I ended up being there for a month. 3 weeks of which were like, when am I going to get out? Because the border had been closed. And this was not only unprecedented, it's a war crime to have blockaded this. It goes against the Camp David Accords, Egypt's agreement with Israel, and it overnight stopped the influx, although already limited, extremely limited, of water and food and really importantly fuel and humanitarian aid workers in and out. Overnight, 35% of the workers coming in had already it stopped, we were gone. And for those of us who were already in there, like we couldn't really get out.
Yeah, that's really an important point that you're speaking about, Bridget, because it speaks to this larger kind of specificity and uniqueness about the kind of situation in Gaza. When one of the things, among the other things that I do is I look at the impact on displaced communities, right? The mental health impact on displaced communities and mass migrations of communities because of wars and occupations and mass disasters. One of the things that makes the situation for Palestinians in Gaza truly unique and especially problematic is that there's nowhere to go. Like the horrors of Afghanistan, Iraq, and Syria, for example, or Sudan, all the other horrific places where there's either civil war or some sort of armed conflict. Communities can pick up and leave, albeit very traumatic in itself. There's an opportunity to leave. That's not the case in Gaza. That's not the case for Palestinians there. Gaza is frequently referred to as the largest open-air prison, right? 2.3 million people unable to leave. Unable to leave. And so when you're dropping a bomb, when you have an F-16 flying over, when you have drones, and I'm going to ask you about drones in a minute, but the drones are a 24-hour kind of sound trauma that you have when you're living in Gaza. For these 2.3 million human beings, these souls who have no place to go. So they're IDPs, internally displaced. They're being told to go from point A to point B. You can't go here, you can't go there. Go to the safe zone. And then the bomb is dropped on the safe zone, which just happened this last week, okay?
And the week before that, and the week before that, and the week before that.
Yeah, exactly. So before we get to the intensity of your experience, I wondered if you could reflect. I think it's important to tell people, Bridget, something about like just the experience of being in Gaza before like some of the more painful realities set in. What was it like for you? Palestinians you met, health workers you met, just like being on the Mediterranean. I mean, that's the reality of Gaza, right?
Yeah. I mean, Gaza, at the time I was lucky to see Rafah pre-destruction. It's completely wiped out now. I was able to go to the water, to go to the sea. And I was able to forge like many really amazing relationships with a lot of healthcare workers who were there working tirelessly, unpaid, and also facing the same dire circumstances as their patients, right? Like walking to the hospital for hours, like losing 30 pounds in the last, at that time, like 6 months. Really like not having their homes anymore, having family members who had died and not being paid by, there's no way to pay them, and facing ridiculously high food prices. And simultaneously, they were so generous and so kind and so sweet, and so great at their jobs. And also, despite what was going on, like they were often very worried about me and my well-being, which was very sweet, but also ridiculous because I got to leave and they didn't, you know. But just very, very like kind and hardworking. Yeah.
Okay, we're going to kind of do a deep dive into maternal and child health. Okay, so you know, before October 7th, some of the highest infant mortality rates on the planet were for Palestinian women in Gaza. I mean, I think before October 7th, it was between 18 and 20, which is among the highest anywhere in the world. So even before October 7th, the healthcare infrastructure in Gaza it's always been compromised and somewhat problematic. There's always been difficulties getting, you know, medicines and supplies in and out, you know. But tell us a little bit about infant mortality, the 50,000 women who were pregnant the day you walked into Gaza.
Yeah. I mean, I think you make a really good point, and this is the thing that I was really struck by the most when I kind of got into Gaza was for such an indigenous culture and indigenous people, how colonial birth had become. And I think that is rooted in years of occupation and also medical siege, right? There's just not, things felt kind of antiquated. And then on top of that, I was met with hospital conditions where we literally did not have enough soap to wash our hands consistently. We didn't have the instruments that we needed to even like cut a cord or open a bag of water, amniotic sac, sorry. It was devastating. And I think, you know, if you think about what a birthing person or a pregnant person needs in order to have a healthy pregnancy, a healthy birth, and a healthy postpartum period, they need consistent care, they need safety, they need food, they need clean water, they need community support, they need time. Time is so important in birth, and in particular, labor takes a long time and it's really frustrating, and you also still just have to kind of sit with it and be patient and go through the process. And when I went to Emirati, it was at the peak. So at this point, all of the other hospitals were essentially destroyed or shut down. And Emirati was the only functioning maternity hospital in Gaza. It currently is not. Right. But at the time it was. And there was 800,000 to 1 million displaced people in Rafah, which is usually a very small, kind of more countryside-like town. Their population is 200,000 to 300,000 people. So the hospital was kind of bursting at the seams. And because of this, people were coming in and having babies and then being sent out back to their tents like within 2 hours. There was no patience. If people weren't progressing in labor, there was like a need to, in some ways, medically at least, unnecessarily kind of provoke and augment labor in order to get things going because of how overpopulated things were. Because of the lack of food and water, women were incredibly like small and malnourished in appearance when they came in. Their babies were small, and there was just like a general smell kind of dehydration constantly. Yeah. Which is also a huge concern postpartum around breastfeeding. If anybody has been in a postpartum experience, like it requires more food and more water than you'll ever need at any other point in your life, including during pregnancy. You're literally feeding this other person in a significant way. And with the combination of the famine that is going on, not only the blockade of clean water coming in, but the bombing of desalination plants by
Right.
Israel, and the lack of any sort of sewage setup for people who are essentially living on like sand or a beach or somewhere with no kind of infrastructure. It's almost impossible. And for these infants as well, if formula is an option, it's wildly expensive, and then how do you make formula when there's no clean water? And with the kind of more recent outbreak and finding of polio in water and so many other things, there's no, you leave the hospital here 24 hours at the most, or at the least, usually 48 hours after having like an uncomplicated delivery. And to go home kind of like within 4 hours without even like a follow-up visit set up for your children, which here, like you have your first visit and your weigh-ins a couple days after babies are born, and no kind of planned vaccine schedule, it is a public health crisis beyond catastrophic public health crisis.
Yeah, I would encourage you all to try to imagine, you know, giving birth, leaving the hospital in 2 hours, going to a tent if you're lucky to have a tent, no clean water, the sanitation system there is no sanitation system, it's completely destroyed.
Sharing a bathroom with hundreds of people.
Literally hundreds of people. And one of the things that I know in kind of from a Western medicine standpoint, Bridget, is the idea of, you know, making sure you have a sterile environment, obviously. That never existed for you when you were delivering babies. There was nothing, you barely had the capability of cutting the cord, like you said. I mean, are you able to talk a little bit about it?
Yeah, I mean, sterility never really exists in birth, let's be honest.
Well,
but
the illusion
there's an illusion of it, and there's an attempt towards it, and there is infection prevention, and there are proper tools. Yes.
Yeah.
And like, no, like we were using like razor blades to cut a cord, and the cord clamps were so crappy that like it wouldn't even like click, you know. To break bags of waters, for those of you who don't know, you know, sometimes this is something we need to do to like progress labor or whatever. Usually we have these like long kind of, it looks like a knitting hook that's like rounded at the edge, so you kind of go in and grab the bag of water and break it. We didn't have any of those. We were like putting like a unclosed needle like in and entering and trying to pop a bag of water with that, which is like a huge safety concern for provider and patient alike, right? There also the conditions of being in a hospital where like bombs, you're literally like giving birth and the building is shaking, and you can hear drones outside, you can hear bombs dropping. A close friend of mine and colleague who was in Gaza right after me at Al Auda Hospital in Deir Bala, literally like the maternity hospital, they had to convert the first floor of it into a morgue, an unrefrigerated morgue. And so to imagine like coming in to give birth and then just smelling death and decay as you're doing it. And it's just constant everywhere. There is not one person in Gaza who's unfazed by like or untouched by what is going on.
Yeah, I wondered if because I think that kind of transitions to a little bit of a discussion about the traumatic exposure that you and everybody else in Gaza went through. And I mean, I heard these stories from my colleagues, you know, the 24/7 experience of listening to a drone. It's horrific. But also the drones had this other kind of evil intent when they were around. And you told me this story, and I don't know if you're comfortable telling it again, but you know, the drones that actually have the voices of babies crying and stuff like that.
Yeah, so one of the like Israeli like violent tactics is something called quadcopters, and these are drones that are equipped with guns and like also a speaker. So one of my first nights there, I kept hearing a baby crying over and over, and I was like, why isn't anybody attending to this baby? And I was under strict kind of rules and regulations from the World Health Organization and the UN, like I can't like leave the place I'm staying for any reason, right? And I found out like the next morning that this is one of these quadcopters, and quadcopters use the sound of like a dog yelping in pain, babies crying, women yelling out for help to lure people out of their homes and their tents and then to kill them. And quadcopter shootings were happening throughout Rafah in the time that I was there. And as traumatic as the drones are, they're also just the least of it, which is so crazy. And it's also interesting how, after being there for a while, the sound of drones actually became comforting to some extent, because when there was no sound, that's when you really got scared, right?
Right. What's it like to feel the concussive impact of a 2,000-pound bomb? I'm kind of curious. I mean, I've been in that experience, but I'm curious what it was like for you.
It's really, it's like, do you know like when a dog hurts itself and it like has a shiver up its spine to like shake it off? Like it does something to your nervous system, you know? And also there's a weird compartmentalization, I guess that's the word, thank you, that I think that I started to do, because there's literally nothing that you can do about it, you know? There's like nowhere that you can go. But it really is like rattling, and you know, it's not just bombing, it's carpet bombing, right? So this is one bomb after the other in just very concentrated areas. What's your experience of it? What was it like for you?
Well, you know, having lived in the Bay for a minute, I mean, I've been through a lot of earthquakes, right? But nothing ever prepared me for the experience of the earth shaking. It's like you're going to get swallowed, is what it feels like. It's like an earthquake times, you know, some order of magnitude. Plus, and I think you spoke to it, it's like, and everybody in Gaza has this experience, and you're exactly right. You know, when there's silence, that's the biggest anxiety, because the drone is kind of painfully and ironically kind of comforting. It is true, because you hear it 24/7. And then when there's silence, you just know that something really horrific is going to happen. And that's exactly what happened. I mean, and maybe we could talk a little bit about the trauma part of it. I mean, there's the physical trauma, but there's the psychological trauma too, which I think, you know, that's the area that I've done quite a bit of work in. You know, for those of you in the healthcare space, they teach you about PTSD, right? Post-traumatic stress disorder. It's kind of a ridiculous concept to think about in the Palestinian context, right? Because for you to have post-traumatic stress disorder, there has to be a post. You know, an event happens, car crash, whatever, and then it stops. And then you have a period of time, and then you may or may not develop symptoms, and if you do, it follows kind of a normal course. What is it like in Gaza, where there's no post? There's a never-ending onslaught of the possibility of imminent destruction and death to your existence. I mean, it never goes away. So when we've done our studies and we've spoken to people, they have a kind of generational, transgenerational, multi-generational, unending traumatic exposure, unlike anything we've seen anywhere in this research. I mean, the research is kind of, it just doesn't match up with the reality. I mean, when we teach PTSD, when we think about treatment modalities, things like that, it doesn't take into consideration a population that collectively shares the experience. And again, for Palestinians, you know, from my introductory comments, there's been generational trauma for 76 years, right? That has never stopped. And so, like, if you're a 15-year-old child, you've been through 5 wars, including the current genocide, which has been going on for almost a year now. So we have to completely rethink our understanding of what traumatic exposure is, because there really is nothing like this. Can you tell us a little bit about your own, like, experience of, like, delivering babies in a war zone?
Yeah.
What was that like? That's kind of wild, actually.
It's wild and it's not. People have babies, you know? It's like
no matter what.
No matter what. Babies are born.
Babies
are born. And when I was in Gaza, this was like the people had still conceived before genocide, right? So one really important part of it is that October 7th on, people no longer had access to any prenatal care, any consistent prenatal care. And then also like no access really to like a consistent like hospital space. I think even for people who I've been in contact with since I've been back, people don't even want to go to a hospital because it's too dangerous, and then also they don't even know if what they need is going to be at the hospital because there's such significant shortages in medication and supplies. And prior to May 7th, when Rafah border crossing closed, the people bringing in all of those supplies were the humanitarian healthcare workers coming in. And after May 7th, that just went away, and the deprivation has been significant. The part that I think is just so striking about people giving birth in Gaza is just the emotional, traumatic aspect. Birth is so important. It is a full-bodied physical and emotional and spiritual moment for somebody's life. It's a really important time of transition, and it is a time in which people can really reclaim their power and really kind of heal themselves from past traumas. And it is also an opportunity ripe with obstetric trauma and other forms of trauma that can happen when you are in such a vulnerable situation. And birthing people really deserve a huge amount of dignity in those situations and control. And what women were carrying in with them when they came to give birth was significant. There's, a woman that I worked with who was crying throughout her entire labor, asking for her mother, who was stuck in the north above a checkpoint, as was the rest of her family, right? And she's here alone, kind of with her husband. Lucky to have her husband, actually, but still, only that, and carrying so much trauma of that. A woman that I worked with who lost her grandfather and went into preterm labor at 34 weeks maybe, and then had a massive hemorrhage afterward and was hospitalized literally in Deir Balah as bombs were going off in such an intense way. One of the first births I had was with a woman she was having her first baby, again, no prenatal care, so no diagnostic testing, and her baby was born with hydrocephalus after really prolonged labor because of the size of the baby's head. An emergency C-section, and I saw that baby die within hours after birth because hydrocephalus is something that we can manage. It's something that surgeons in Gaza can manage, and something that was entirely impossible to manage actually at that moment because of Israeli violence, because of the siege, because of the blockade, and the blockade even for medical evacuations. At this point, any sort of urgent medical evacuations just were not possible or happening. And then once Rafah border crossing closed, and it is still closed, this is a huge issue. Now, nobody is getting out, and if they are, they're only allowing unaccompanied children to leave.
Right.
It's horrendous.
Wow. I'm just going to check in with the organizers really quick in terms of how much, because Bridget and I could talk forever.
Keep going. I'd say another 15 minutes and then we'll open it up for questions.
Great.
And we'll pass around the QR code for folks.
Okay.
I do think though that what has been happening as I've been asked about my experience is that people are used to kind of the emergency trauma surgeons report backs, which is a lot more gruesome than what my experience was. And I think that birth is inherently really protected in a lot of ways because it still is a big point of joy. And the family unit is so important in Palestinian culture. Family is literally everything, and bringing another life into this world, especially amid such loss, feels so important. But I keep being asked about the physical stuff. And as a person who believes in physiologic birth, I'm whatever, you can just have a baby at home and it'll be okay, and it may not be the best situation, but you can just do it. I think that this idea of how to quantify the effects of trauma on birthing people in their bodies, on their families, on their newborn babies is something that we haven't even begun to approach. And I think that a lot of people, since we can't quantify it, can't take it very seriously quite yet.
Yeah.
But to even be in the womb during this, and then to be born into this, and to carry a child while losing other children simultaneously. There's many mothers that I saw who had already lost children during the genocide who were then having another. It carries such a heavy weight, and I'm really curious if you can kind of speak to that more.
Yeah, I think that's really such an awesome question, Bridget, and you're right. We don't talk enough about that part of it, but that's why we have to completely transform our understanding of trauma, because we're talking about kind of a multi-dimensional traumatic exposure for these women giving birth, and as you said, giving birth in a context in which they've already had tremendous loss. They may have already lost children or family members or loved ones. There is loss associated with, just the family unit that is being affected. My colleague, Ghannam used this term called the biosphere of genocide in terms of what's happening in Gaza right now, which is this kind of dimensional aspect where every aspect of your existence is being flooded with these traumatic events, right? Physical trauma, psychological trauma, eco-trauma. I mean, that's the other thing in terms of giving birth right now, is that the amount of munitions and toxic substances that have been dropped on Gaza right now, the kind of destruction of the water systems. So if you're asking me about that dramatic impact, it's occurring from the genetic level to the cellular level to the the ecosystem, the biosphere. It's occurring at every level of existence right now. I think that this is going to have a multi-generational impact. Prior to October 7th, I was already seeing the generational impact of trauma, right? From the 76 years of the settler colonial project, the 5 wars in Gaza, the blockade, all of that stuff was having a profound traumatic impact. And if you'll let me just kind of, is that okay?
Yes, please.
Because this is really an important point. I feel really obligated to speak about this because frequently Palestinians, and especially Palestinian children, there's this label that gets put on them. Look at how resilient they are, right? And I think that's really problematic, to use that word, that they're resilient, right? Because you know what resilience is? Resilience is, under difficult situations, you're able to thrive. That's really the true meaning of resilience. I guarantee you 100%, no child in Gaza is thriving now. So there's that tendency to heroicize and mythologize Palestinian children and Palestinians in a way that is very, I think, inhumane, because it tends to almost fetishize it. Because the reality on the ground is that people are starving to death. The entire aspect of civil society is being destroyed, and to actually say, "Oh, Palestinians are so resilient," is really kind of at best disrespectful. Yes, there's the resistance. We have that word in Arabic, samud, which means being steadfast. Yes, people are living and they're able to carry on and do some things like you witness, Bridget. People are able to give birth. People are still generous with you in the face of a genocide, which is really extraordinary. But that's not resilience. Because I guarantee you, as I said, no one's thriving in these situations. So I hear that so often, and I think we just have to check ourselves on that and be really careful about the phrases and the phraseology we use to describe what's happening there, because the idea somehow that Palestinians and Palestinian children are thriving under a genocide is really, it's kind of this kind of heroic mythological perspective, which is just not reality. I don't know what's going to happen in terms of looking at the traumatic long-term effects, Bridget, because prior to October 7th, when I was thinking about, how are we going to help these children who have been exposed to so much trauma, we had to develop an entirely different model. Like the model we have in the Bay, or what we have here in the West, it's kind of funny, right? We have more shrinks per capita in the Bay Area than any place in the planet. And you still can't get an appointment. Try it. I mean, I'm serious. Try to get an appointment with that mental health provider. You can't. And the first time I went to Gaza, it was a funny, bizarre story. I land, I get there, I say, take me to your mental health facility. I really want to see it and find out about it. The taxi driver, this is the 1990s, by the way, starts laughing uncontrollably. And he won't tell me why. I said, in Arabic, I was saying to him, come on, what's going on? He was just, tears were coming from his eyes. So we're driving through the streets of Gaza and going through, and he takes me to this beautiful home. He says, here's your psychiatric facility. And it was the home of a psychiatrist, Iyad Sarraj. He was the only psychiatrist at the time for 1.6 million people. Think about it. We have like 10 shrinks per capita here in the Bay Area. That's not that. It's a joke. But I'm just saying that in contrast to one psychiatrist for 1.6 million people. And in those 20-some years, we co-developed with my colleagues in Gaza, community mental health-based programs and therapeutic playgrounds and different ways of intervening. Because one of the things that I witnessed, and maybe you can speak to this, is that what I was seeing in children is this struggle and this difficulty and at times inability to play, right? One of the things that's really amazing if you understand evolutionary biology in mammals, for example, is that the capacity to play is so fundamental to emotional, cognitive, and physical development. I mean, this is just common sense stuff, right? But we tend to ignore it. And I was seeing that in Palestinian children. They're like shut down from being able to play for lots of reasons. So we developed therapeutic playgrounds. Sounds really kind of like a complex concept, but basically what we did is to create spaces so children could play. And when we did that, we were just like phenomenally blown away by its impact. It was just mind-boggling to see the positive impact of providing the spaces and the time so that children could actually play.
I think one of the things that I was most struck by was like how old everybody was in Gaza. Like people much younger than me felt like they were older than me.
Yeah.
Children seemed very, like there was like an adultification really that happened for kids that I think is like really consistent. And especially in a situation where you're like now taking the only person left in your family taking care of your baby sister and you're like 12. Like you step into those things, and I think that this genocide has only, I think, amplified that experience.
Yeah, and and talking about amplifying that, for the first time in history for Palestine and for Palestinians, you have children who are true orphans without any surviving family members. It's a new phrase, it's a new word. We've never had that before, because even prior to October 7th, with all the wars, let's say a mother or a father or both were killed in that war, there was always extended family to take that child in. There were no orphans in the classical sense of the word. We now have real orphans where entire families have been wiped out, and there's no extended family for these children to go to, okay? So that psychological impact is pretty devastating, obviously. I think about this all the time in thinking about how we're going to rebuild. It's hard to think about rebuilding when in fact we're in the midst of coming on a year of a genocide now. And I said this in my opening comments, it's like, there's not going to be a ceasefire. You all have to get ready for this. If the United States and Israel wanted a ceasefire, there would have been one 11 months ago. So you have to understand the dynamics of this situation, that there's no intention in reality for a ceasefire. The intentionality is to create facts on the ground where an indigenous community like Palestinians in Gaza will no longer exist. That's the plan. And that's why what we're doing here, making space to have this kind of conversation, for having and I'm going to use this term for you, Bridget, heroic midwives Heroic midwives. I think midwives are pretty awesome.
Midwives are awesome. I'll agree with that.
I mean, midwives are pretty awesome. Unbiased, but they are. I mean, you know, we don't have time to go into the history of midwifery and all of that, although I'd love to. But there is a rich history of midwifery in Palestine. I mean, you found that out when you were there, right?
Yeah, a really rich history, and also like a healthcare system that's dominated by midwives, which is so cool, you know. And with every indigenous culture comes a rich history of birth and supporting birth and being healers. Like that's who midwives are. And I just kind of actually want to say, as we're talking about kind of healthcare workers and like the people in the room, you know, one of the reasons why Jess and I got connected is that I was being pretty repressed in the workplace for my activism for Palestine, for wearing a keffiyeh, for wearing a watermelon, this sort of thing.
This is very dangerous.
Seasonal fruit.
Seasonal fruit
Yes.
is very scary. Don't you all realize that?
Well, the acknowledgement of Palestinian existence, I think, is very scary, unfortunately, for some people. And I think that, you know, it's really a privilege to be able to talk to a group of other healthcare workers and other healthcare workers who are hopefully, and I believe, like, have shared values around kind of the importance of like social justice and of human rights and health equity in all these ways. And I really encourage those of you who have not yet gotten involved to look into working with Healthcare Workers for Palestine, to join the affinity group, because our solidarity in this is important, and our voice in this is incredibly important. There is another level and a different type of respect that I see when it's nurses and doctors and medical and healthcare workers saying this over just community members. And I am realizing that despite kind of many intimidation tactics that I have faced, that Jess has faced, that, you know, other folks have faced, that, you know, our solidarity is really important, because they can't really do anything to us if we're all together. You know, if it's just one of us, intimidation works, but if really it's all of us standing up for this global public health crisis, really is what it is, that, you know, we can accomplish a lot.
Yeah, I think that's really so right on, Bridget. And, you know, we in the Bay like to pride ourselves on health justice, health equity, health inclusion, as we should be celebrating and working to promote health justice for all marginalized communities. So my question is, why is there this exclusion when it comes to health justice for Palestinians? And why is this exclusion for people who want to work in solidarity? Like, can you imagine shutting down solidarity work for our African American communities in the Black Lives Matter movement and the White Coats Matter and all of the work that we did and continue to do, saying you can't do that? I mean, I guess they
Not in 2024, but yes. I mean,
Yeah.
in previous times, but we've moved past that,
think
at
we
least
would
at
have-
UCSF.
Yeah.
Or in
Yeah.
San Francisco, yeah.
Yeah, and the same with LGBTQ plus rights and indigenous rights, healthcare rights, health justice rights. But there seems to be a different kind of exclusion or exception when it comes to Palestine. And that's really what we're here to not just call out, but as you said, Bridget, it's really important. When we are working in solidarity with one another, there's so much more power. The other thing that I think is really important about when we do these events, when we're in the streets, when we wear our seasonal fruit, you know, these images get back to people in Gaza. And the bleakness of the experience of being Palestinian in Gaza right now, and West Bank and in Jerusalem, can be mitigated, is kind of softened when I or a group of us send back pictures of protests or pictures of healthcare workers, you know, at work wearing a watermelon or a keffiyeh or something like that. It makes an impact on the ground. People feel like they haven't been forgotten. And that's very deep. That's the best antidote to the grim reality of this experience. Like, you know, don't you all, and this is what people say to me all the time in Gaza and West Bank, does anybody really care that these bombs are dropping and that this genocide is occurring? And so when they do see the encampments, when they do see the protests, when they do see us kind of standing in solidarity, it has a really positive impact. So we have a positive material impact for folks in Gaza, but we're also making a difference here. And I think you're right, Bridget. When healthcare workers stand up to this, people do listen. I think we're, yeah, go ahead.
On that note, I was going to say, I think that we have some questions.
Do we have questions?
Yeah.
Oh no.
Yeah, so thank you both so much, and we do have some questions coming in. We want to keep the conversation going with some of your questions, so please, if you haven't already, you can use the QR code or the bit.ly to put your questions in. We have a bunch of questions coming in, and I'm gonna, you want me to just do it? All right. So there's a few first that are more health related. We'll start with those, and then there's some more that are kind of more organizing related. So this one's for Bridget. What health complications related to menstruation have you encountered among women affected by the conflict, and what recommendations would you make to improve menstrual health support in conflict situations?
I mean, I think that there is a very clear effect of like stress and also malnourishment on periods and menstruation. There also going on actively in Palestine is a lack of sanitary pads. And we have seen really upsetting like reports of people using tent scraps and that sort of thing. Unfortunately, there also is like a significant rise to vaginitis, so different forms of like vaginal infections either by yeast or like kind of bad bacteria overgrowth that have compromised women's health pretty significantly. And I think that in other situations, other like areas of other conflict zones, it's often supporting people by shipping supplies and doing this sort of thing. And that's not the case in Palestine. The only solution to that would be a ceasefire, unfortunately, an immediate humanitarian aid and an end to the blockade and the siege. Yeah.
Thank you. The next question is, how has the ongoing conflict affected women's access to abortion? Would you say you see an increase given circumstances? And what is the stance of abortion and women in Gaza?
Yeah, so remember that Palestine is a very religious country and abortion is not legal there. So there is no access to it. However, there is access to birth control, and it is something that is culturally accepted, and without routine outpatient like gyne visits, it is also something that is not happening. And although like a desire for it, given the fact that people don't want to be bringing a child in under these circumstances. We've also seen a really marked increase in miscarriage rate, preterm birth, gestational hypertension, other issues like that. I did have a moment actually when somebody came in to talk to me on labor and delivery and asked me for an abortion, which was like a pretty devastating moment because it was not something that I can provide. But it's totally clear that people are doing this because of how dire the circumstances are.
Thank you. Jess, this one I think is for you. Have you observed measurable outcomes from neurofeedback in trauma and displaced survivors? If not, do you see a future of neurofeedback in treating mental health issues amongst displaced communities due to genocide particularly?
Wow, that's a really specific question. It's actually a really good question. So neurofeedback, let me be brief.
Here we go. I'll mute my mic.
So here's kind of one of the biggest problems when you're talking about this level of trauma, right? And inexperienced clinicians make this mistake all the time, which is, your natural inclination is to tell people who have been traumatized, well, let's just talk about it, right? Let's talk about your traumatic experience, right? Many times that's like the worst thing you can do. Why? Because it triggers. The act of speaking about the trauma without doing the groundwork, without doing the prep work, can sometimes exacerbate and trigger and reinforce the trauma. So it sounds counterintuitive, but sometimes talking about the trauma is not the best treatment. And in some cases, it's because the triggers, the central nervous system triggers, are just so active and inflamed, right? So there's this really interesting treatment that I do and many people do called neurofeedback, where you're basically kind of training the central nervous system, mostly the brain, to kind of not be so inflamed. And what's really cool about that treatment is that it's transcultural. It doesn't require language skills. It transcends, time and place. You can do it almost anywhere. So interestingly, there's a group of us who are very, very ready and are to do some training and implementation of neurofeedback training for large communities in Gaza and outside, many of whom are in Egypt right now, unable to access healthcare, to deal with it. So I think it's a really promising, it's non-pharmacological, and again, even though verbally and physiologically you may not be ready to talk about the trauma, you can do things with your central nervous system. That was a little too technical, I think, but is that okay? Sorry.
This is, I think, really for both of you. I've been told so many times by leadership and colleagues and others that what is happening in Palestine is, quote, not relevant to our work. This does not resonate with my experience of the suffering of our Palestinian and other patients and colleagues and understanding of health equity work. Yet would love to hear your remarks about this. Thank you.
Well, I'm sorry, first of all, that that's your experience, and I think you're completely right in your convictions and knowing that this does have to do with us. And this does have to do with us because the 2,000-ton bombs that are being sent over to Gaza are with our tax dollars, right? This does have to do with us because of the intersectionality that I spoke to earlier between the United States police force and the Israeli military. This does have to do with us because we, as healthcare workers, come to this work with a shared goal and value of really making sure that everybody is well. And it is so actively clear how unwell this entire situation is. And not only are folks in Gaza obviously devastatingly unwell because of what they're experiencing, but we hear people of conscience are unwell because of what we have been consuming for the past 11 months of what's going on. And the people who are ignoring it and trying to suppress us are also unwell because they have lost touch with their humanity. Jess?
Yeah, Bridget and I, we've had this discussion so many times. I would say the unwellness of the people who are trying to suppress this far exceeds the unwellness of Palestinians in Gaza. Because the amount of moral, ethical rot you as a human being have to hold to say we shouldn't talk about this is really extreme. What universe are we in the health professions where we would ever say, don't talk about a public health crisis? What universe is that? That we would say it's okay to talk about this community, but not that community. That's such a fundamentally racist formulation. And basically, what it is anti-Palestinian racism. That's really what it is. This is the Palestine exception. This is anti-Palestinian racism. We have a moral, ethical obligation to speak and to call out the negative health consequences of a genocide and to say this is unacceptable. And Bridget, you're 100% right. How can we say this doesn't have to do with us when we have people right around San Francisco General who don't have access to health care, and we're sending $20 billion just last month for more weapons? Where we still can't get access and adequate health care to marginalized communities in San Francisco, one of the wealthiest places on the planet. And we're not going to talk about billions of dollars being displaced and sent to a war machine, genocide machine. I think that the sickness is in the system, that we are not able to speak about this freely. But I have breaking news. We're going to talk. we're not backing down. We're going to fight this. And no, and I'm serious. I mean, because here's this. We're not just trying to save Palestine. We're trying to save UCSF. We're trying to save the general from the moral rot that is being created right now by the oppressive nature of shutting down this debate. And we will fight it. And we're going to fight it because none of us are going to be free until Palestine is free. And we know it. It's really traumatic. It's kind of a moral gaslighting. It's really like really bizarre gaslighting. I get told almost every day that my existence, manifested in a piece of seasonal fruit, makes people feel unsafe. And my statement is, it doesn't make you feel unsafe. It may make you feel uncomfortable, and it should make you feel uncomfortable. Talking about a genocide is uncomfortable. Talking about health injustice is uncomfortable. And so let's not confuse discomfort with feeling unsafe. This is nothing about safety. This is about making a space and having the opportunity to talk about things that make you uncomfortable, not me. I love talking about this stuff. Bridget, you love talking about this stuff. My colleagues here, we talk about this all the time. And I know we all feel the same way, which is we must talk, we must speak, we must act. And we all feel that.
Thank you. And the last question I think we'll have time for, and then I want to share just a couple of the comments that have also been coming in before we hand it over to Anna to close out, is what can we as public health professionals do right now to take action?
I mean, as I mentioned before, and get connected with Healthcare Workers for Palestine, get connected if you were within DPH with the affinity group, wear your watermelon pins, wear your keffiyehs, stand in solidarity, speak to your colleagues and your community members. Again, this would not be happening if the United States were not funding this genocide, period. So if you are met with, repression, that really is the answer. This is about you because you're a taxpayer. And I think that continuing to speak up and to kind of continue to grow like this solidarity, this coalition, is going to be really, really important for us, and also is going to provide safety for us too.
Yeah, I think that's really right, Bridget. I'll say if anybody here, either in the crowd or watching, feels that they're being suppressed or oppressed by their advocacy work, doing Palestine solidarity work, you should reach out to me or reach out to Faculty and Staff for Justice in Palestine or the DPH Affinity Group, because there's a national and global solidarity movement going on for health workers. And it's not just health workers, it's lawyers, it's intersectional activists, and they want us to be siloed, right, and be fearful of speaking. And you said it, Bridget, it's 100% right. If we're unsiloed and act collectively, we have tremendous power. So we need to keep organizing as a collective. Can you share some of the hostile comments that have been coming in?
We have not received any hostile comments.
I love the hostile comments. I really do.
We've received comments that say the information shared by the panelists has been incredibly eye-opening. Thank you so much for taking action and establishing this affinity group. This is desperately needed to continue to bring light to the horrific genocide that is happening. Thank you so much. This was the most powerful talk I have attended in a very long time. I'm heartbroken and in solidarity. Thank you for sharing your heroic story with us, Bridget, and thank you both for creating this space for information and reflection. I pray for a free Palestine. Yeah, so I know there's a lot more to talk about, and I'm gonna, in just a moment, the rest of the questions we didn't answer are about how do you join these groups. So in just a moment, I'm gonna hand it over to Ana Delgado, another amazing midwife, to share that with us. But first, we wanted to just take one moment again to thank our amazing speakers, Jess and Bridget, and give you a little token of our appreciation.
My name's Ghannam. I'm a midwife here. I've worked here for 17 years, and I'm very, I don't think I've ever felt more blessed or honored to be a midwife, honestly. When Bridget was a student with us many years ago, her class came up with a slogan called "The Revolution Will Be Midwife," and that is absolutely true. And being a midwife in and of itself is a revolutionary act in our Western medical model. And we are living amongst you here. We welcome you to join us in this struggle with our rest of our healthcare worker colleagues who are come from all different disciplines and all different walks of life. And you don't even have to be a healthcare provider. There's public health people here, policy people. All of us are together on this issue. So please feel welcome, no matter who you are, what you identify. Even if you're just a community member and you're just wanting to be in solidarity with people who are working on this, please reach out. So there's several ways to get involved, and there's a QR code here that has these links. So if you don't have time right now to go and do this all, you can scan this code and you can get the links right there on your. But as Bridget mentioned, there's a group called Healthcare Workers for Palestine. This is a national organization, but it's also a very active Bay Area group that you can join. The San Francisco Department of Public Health, Health Justice for Palestine Affinity Group, were the primary organizers of this event, and members of this group, members of this group also table on Fridays. You may have seen some of us. I'm not an official member because I'm officially UCSF employee, so I can't officially join the affinity group, but I'm like a groupie. I'm a groupie of this group. And the tabling that you may have seen on Fridays at noon that we've been doing out in the plaza, stop by. We love to chat with folks. Bring your friends. It's a great time to just meet people right here on this campus that are doing this work. I'm an officer of the UCSF Faculty and Staff Justice for Palestine group, newly formed. And so that's a way to get involved if you're faculty or staff at UCSF. And then if you're a student at UCSF, there's a Students for Justice in Palestine group as well. So these are all ways that you can get connected to the work that's ongoing right now, and start to, frankly, reclaim your own humanity and start to heal some of that trauma that we are all feeling. The disconnect of being here in a healthcare system, which again has its problems and is low resourced in its own way, but just witnessing the complete dissonance of what it's like to care for people here and then compare it to what is happening in Palestine. I think if there's anything that I can leave you with is that we are stronger together. If you are feeling alone, that is a sort of a fabrication. You are not alone, absolutely not alone. And we are together, and we will only rise if we rise together. So please come, be part of this movement, be part of this movement. For now and in all the ways that we talked about, it's a window into all types of liberatory work. And I think with that we'll close.